MSN Exam for bladder cancer. Question 1. A client with bladder cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to A. Strain his urine. B. Increase his fluid intake. C. Report urinary frequency. D. Avoid prolonged sitting. Answer: A. Strain his urine. Iridium seeds can be expelled during urination, so the client should be taught to strain his urine and report to the doctor if any of the seeds are expelled. Increasing fluids, reporting urinary frequency, and avoiding prolonged sitting are not necessary. Question 2. Aniline dyes have been linked to cancer. A. True. B. False. Answer: A. True. Question 3. Does not respond at all to radiation. A. Grade 2. B. Grade 3. C. Grade 1. D. Grade 4. Answer: D. Grade 4. Question 4. Occupational exposure to pizza making has been linked to bladder cancer. A. True. B. False. Answer: B. False. Question 5. Toxicity levels are unacceptable if the patient is worse off than before treatment. A. True. B. False. Answer: A. True. Question 6. Superficial bladder cancer can be treated by direct instillation of the antineoplastic antibiotic agent mitomycin Mutamycin. This process is termed A. Intraventricular administration. B. Intravesical administration. C. Intravascular administration. D. Intrathecal administration. Answer: B. Intravesical administration. Medications administered intravesically are instilled into the bladder. Intraventricular administration involves the ventricles of the brain. Intravascular administration involves blood vessels. Intrathecal administration involves the fluid surrounding the brain and spinal cord. Question 7. Very low degree of malignancy. A. Grade 2. B. Grade 3. C. Grade 1. D. Grade 4. Answer: A. Grade 2. Question 8. A client has been diagnosed as having bladder cancer, and a cystectomy and an ileal conduit are scheduled. Preoperatively, the nurse plans to A. Limit fluid intake for 24 hours. B. Teach the procedure for irrigation of the stoma. C. Teach muscle tightening exercises. D. Provide cleansing enemas and laxatives as ordered. Answer: D. Provide cleansing enemas and laxatives as ordered. Question 9. Anticholinergics. A. Drugs that decrease bladder outlet resistance. B. Drugs that simulate detrusor contractility and promote bladder emptying. C. Drugs that inhibit contractility and promote urine storage. D. Drugs that increase bladder outlet resistance. Answer: C. Drugs that inhibit contractility and promote urine storage. Question 1. What is the most common type of bladder cancer? A. Squamous cell carcinoma. B. Transitional cell carcinoma. C. Epithelial hyperplasia. Answer: B. Transitional cell carcinoma. Question 11. Can coffee cause bladder tumors? A. Yes. B. No. Answer: A. Yes. Question 12. How does bladder cancer rate on the most commonly occurring GU cancer in adults list? A. First. B. Second. C. Fourth. D. Eighth. Answer: B. Second. Question 13. Well differentiated but fully malignant. A. Grade 1. B. Grade 2. C. Grade 3. D. Grade 4. Answer: C. Grade 3. Question 14. Recurring UTI, V and leukopenia are all adverse reactions to chemotherapy, and what else is one? A. Fistulas. B. BPH. C. Penile prostatic. D. Nephrotoxicity. Answer: D. Nephrotoxicity. Question 15. Beta-adrenergics. A. Drugs that increase bladder outlet resistance. B. Drugs that inhibit contractility and promote urine storage. C. Drugs that simulate detrusor contractility and promote bladder emptying. D. Drugs that decrease bladder outlet resistance. Answer: B. Drugs that inhibit contractility and promote urine storage. Question 16. Response is poor to radiation. A. Grade 3. B. Grade 1. C. Grade 2. D. Grade 4. Answer: C. Grade 2. Question 17. The female client who has been receiving radiation therapy for bladder cancer tells the nurse that it feels as if she is voiding through the vagina. The nurse interprets that the client may be experiencing A. Rupture of the bladder. B. The development of a vesicovaginal fistula. C. Extreme stress caused by the diagnosis of cancer. D. Altered perineal sensation as a side effect of radiation therapy. Answer: B. The development of a vesicovaginal fistula. A vesicovaginal fistula is a genital fistula that occurs between the bladder and vagina. The fistula is an abnormal opening between these two body parts and, if this occurs, The client may experience drainage of urine through the vagina. Question 18. What would be an indication to use chemotherapy? A. Complete resolution of abnormal serum tumor markers. B. Location of tumor. C. Chronic reflux. D. N. V. E. Recurring cyst. Answer: A. Complete resolution of abnormal serum tumor markers. B. Location of tumor. Question 19. High degree of malignancy, usually anaplastic California. A. Grade 2. B. Grade 1. C. Grade 4. D. Grade 3. Answer: C. Grade 4. Question 20. Transitional cell carcinoma (TCC) is A. A poorly differentiated carcinoma often without any papillary growth. B. A benign proliferation of urothelium in response to inflammation or irritation. C. A type of malignancy that arises from the urothelial lining of the urinary tract. D. A cancerous growth on the urothelium causing disintegration of the bladder wall and urothelium. Answer: C. A type of malignancy that arises from the urothelial lining of the urinary tract. Question 21. What is a random bladder biopsy done for? A. Stage and grade verification. B. Invasive. C. Non-invasive. D. Smaller tumors. E. Stages T1 T4. Answer: A. Stage and grade verification. Question 22. From below, what are symptoms of bladder cancer? Choose answer that apply. A. Painful hematuria. B. Frequency and urgency. C. Dysuria. D. Flank pain. E. Abdominal pain. Answer: B. Frequency and urgency. C. Dysuria. D. Flank pain. Question 23. Estrogens. A. Drugs that simulate detrusor contractility and promote bladder emptying. B. Drugs that increase bladder outlet resistance. C. Drugs that decrease bladder outlet resistance. D. Drugs that inhibit contractility and promote urine storage. Answer: B. Drugs that increase bladder outlet resistance. Question 24. Drugs that decrease bladder outlet resistance. A. Alpha-adrenergics blockers. B. Estrogens. C. Beta-adrenergics. D. Alpha-adrenergics. Answer: A. Alpha-adrenergics blockers. Question 25. The health of the patient is a factor in deciding to use or not to use chemo. A. True. B. False. Answer: A. True. Question 26. Does respond to radiation? A. Grade 3. B. Grade 4. C. Grade 2. D. Grade 1. Answer: A. Grade 3. Question 27. Beta-adrenergic blockers. A. Drugs that increase bladder outlet resistance. B. Drugs that decrease bladder outlet resistance. C. Drugs that simulate detrusor contractility and promote bladder emptying. D. Drugs that inhibit contractility and promote urine storage. Answer: A. Drugs that increase bladder outlet resistance. Question 28. Alpha-adrenergics. A. Drugs that inhibit contractility and promote urine storage. B. Drugs that decrease bladder outlet resistance. C. Drugs that simulate detrusor contractility and promote bladder emptying. D. Drugs that increase bladder outlet resistance. Answer: D. Drugs that increase bladder outlet resistance. Question 29. A male client is being transferred to the nursing unit for admission after receiving a radium implant for bladder cancer. The nurse in charge would take which priority action in the care of this client? A. Place client on reverse isolation. B. Admit the client into a private room. C. Encourage the client to take frequent rest periods. D. Encourage family and friends to visit. Answer: B. Admit the client into a private room. The client who has a radiation implant is placed in a private room and has a limited number of visitors. This reduces the exposure of others to the radiation. Question 30. Lowest degree of malignancy. A. Grade 1. B. Grade 2. C. Grade 3. D. Grade 4. Answer: A. Grade 1. Question 31. Resistant. A. Grade 1. B. Grade 2. C. Grade 3. D. Grade 4. Answer: A. Grade 1. Question 32. Cigarette smoking can cause bladder cancer, but at what ratio to non-smokers? A. 3 times greater. B. 4 times greater. C. 5 times greater. D. 2 times greater. Answer: B. 4 times greater. Question 33. Most frequent presenting symptoms. A. Painless hematuria. B. Flank pain due to urethral obstruction or pelvic mass. C. Frequency. D. Constipation. Answer: A. Painless hematuria. Question 34. Occupational exposure to aromatic amines cannot cause cancer. A. True. B. False. Answer: B. False. Question 35. How many grades of cancer are there? A. 5. B. 4. C. 3. D. 6. E. 8. Answer, B. 4. Question 36. What percentage of bladder cancers does squamous cell carcinoma account for? A. 3%. B. 5%. C. 50%. D. 95%. E. 75%. Answer, A. 3%. Question 37. Mr. Pablo, diagnosed with bladder cancer, is scheduled for a cystectomy with the creation of an ileal conduit in the morning. He is wringing his hands and pacing the floor when the nurse enters his room. What is the best approach? A. Good evening, Mr. Pablo. Wasn't it a pleasant day today? B. Mr. Pablo, you must be so worried, I'll leave you alone with your thoughts. C. Mr. Pablo, you'll wear out the hospital floors and yourself at this rate. D. Mr. Pablo, you appear anxious to me. How are you feeling about tomorrow's surgery? Answer, D. Mr. Pablo, you appear anxious to me. How are you feeling about tomorrow's surgery? The client is showing signs of anxiety reaction to a stressful event. Recognizing the client's anxiety conveys acceptance of his behavior and will allow for verbalization of feelings and concerns. Question 38. Tricyclic antidepressants. A. Drugs that inhibit contractility and promote urine storage. B. Drugs that increase bladder outlet resistance. C. Drugs that simulate detrusor contractility and promote bladder emptying. D. Drugs that decrease bladder outlet resistance. Answer, A. Drugs that inhibit contractility and promote urine storage. Question 39. A male client with bladder cancer has had the bladder removed and an ileal conduit created for urine diversion. While changing this client's pouch, the nurse observes that the area around the stoma is red, weeping, and painful. What should Nurse Katrina conclude? A. The skin wasn't lubricated before the pouch was applied. B. The pouch faceplate doesn't fit the stoma. C. A skin barrier was applied properly. D. Stoma dilation wasn't performed. Answer, B. The pouch faceplate doesn't fit the stoma. If the pouch faceplate doesn't fit the stoma properly, the skin around the stoma will be exposed to continuous urine flow from the stoma, causing excoriation and red, weeping, and painful skin. A lubricant shouldn't be used because it would prevent the pouch from adhering to the skin. When properly applied, a skin barrier prevents skin excoriation. Stoma dilation isn't performed with an ileal conduit, although it may be done with a colostomy if ordered. Question 40. Cholinergics. A. Drugs that increase bladder outlet resistance. B. Drugs that inhibit contractility and promote urine storage. C. Drugs that simulate detrusor contractility and promote bladder emptying. D. Drugs that decrease bladder outlet resistance. Answer, C. Drugs that simulate detrusor contractility and promote bladder emptying. Question 41. Drugs that inhibit contractility and promote urine storage. A. Antispasmodics. B. Beta-adrenergics. C. Cholinergics. D. External sphincter, striated muscle relaxant. Answer: A. Antispasmodics. Question 42. A male client is receiving the cell cycle nonspecific alkylating agent Preoperatively, 60 mg weekly for 4 weeks by bladder instillation as part of a chemotherapeutic regimen to treat bladder cancer. The client asks the nurse how the drug works. How does the OTP exert its therapeutic effects? A. It interferes with the deoxyribonucleic acid DNA replication only. B. It interferes with ribonucleic acid RNA transcription only. C. It interferes with DNA replication and RNA transcription. D. It destroys the cell membrane, causing lysis. Answer: C. It interferes with DNA replication and RNA transcription. The OTP interferes with DNA replication and RNA transcription. It doesn't destroy the cell membrane. Question 43. Artificial sweeteners, pelvic irradiation and chronic cystitis can't cause cancer. A. True. B. False. Answer: B. False. Question 44. Higher levels of toxicity are acceptable if the cure can be achieved. A. True. B. False. A. True.
Thanks for watching. Please comment, like and share.